Researchers from the Medical School of Perelman at the University of Pennsylvania found that the vast majority of obese patients' languages are larger and contain more fat. You talk, eat and breathe with the help of the language, then why is there fat, says the study's author, Dr. Richard Schwab from the Medical School of Perelman, Philadelphia. The reason is unclear. Perhaps this is due to genetically or environmentally, but the less fat, the less likely it is that the fabric of a language zaplotiate in the airway during sleep. The most common disorder is obstructive sleep apnea, when the tonsils or other tissues in the back of the throat partially or completely block the upper airway. Overweight people have excess tissue in the back of the throat, which press on the airways. Therefore, even a small weight loss can open the throat and relieve the patient's life. Researchers from the University of Pennsylvania examined 67 patients with obstructive sleep apnea who had the extra weight. Losing 10% of body weight, they have reduced their symptoms by 30%. Now that we know that excess fat on the tongue is an important factor in the risk of sleep apnea, we have established therapeutic target that we did not have, said Dr. Schwab. We know that weight loss is important because it can help to expand the upper respiratory tract of the patient, shares his impressions of work colleagues Nick Gopin from the British Lung Foundation. However, this study does not yet have practical significance. It provides additional information about the mechanism of obstructive sleep apnea, but doesn't explain how to remove fat from the language, so can't help the sick.